Our second company presenting today will be Maia Health, led by their founders Jorge Mejia and Eduardo Large. Founded in Colombia, Maia aims to bridge the gap to better healthcare by connecting physicians, patients, and caregivers with real-time information about what the patient is actually experiencing and how they're responding to treatment outside of the physician's office. By creating the first social network designed entirely for cancer patients, caregivers, survivors, and family members, Maia encourages a paradigm shift from the traditional healthcare record and encourages patients to take a more active voice in their care decisions and recovery. Maia has already seen marked traction in numerous hospital and pharmacological partnerships in both the US and LATAM and aims to continue growing their success in 2022. Jorge, after you.
Hello, everyone. Just give me a second. I will share the screen with for everyone of you. Just give me a sec now. And share screen. Just give me a second. Sorry. There you go. Screen. Okay. Sure. There. Are you able to see my screen at the moment?
Yes.
Yes.
Okay, thank you very much. Well, we are Maia Health, and what we do is that we try to defeat cancer through information. We are the first in the sole digital ecosystem for smart disease management in cancer. And this is very interesting because this journey starts with the diagnosis. Whenever you get the diagnosis, or your friend, your family gets that diagnosis, sorry, this is running without me. You get in a void of useless information. Unfortunately, that is the big problem. In healthcare, information is siloed or fragmented. And this is as debilitating as the illness, as we say here. So what we planned and what we achieve is a solution in which we could include patients, doctors, and the institutions. So that ecosystem allows the information to flow in a way that we could help the therapy journey. So we created an interaction of information based on a social network and an outpatient follow-up strategy. That's what configures what Maia is. So what we do that and how we do that, we have ethical live data collection. So we capture the information from the patient, or the sources that it's important for the patient. That's why we integrate the data, as we say that. And then we create and we support through AI and predictive models in a HIPAA compliant platform. All that information comes about, but everything is tied up with a social network, and a social network that responds to the need of a patient to help others, to communicate, and the need for doctors to be present, to have an audience, and other healthcare practitioners as well. So this is what we start to creating. We create this smart disease management that allows us an advanced coaching for the journey in cancer. So as you see, our social network, it's a patient-centric part in which the patient can tell their story to help others, in which there's curated information, in which we could help the patient lessen their anxieties, and the patient can actually be active. Sometimes as a patient, you don't want to talk to your family as much as you wanted to talk to other people about this. But if you want to talk with your family would be well informed to cross this scenario. So in summary, we are a person-centric social network for the cancer journey. We are a companion to patients, confidant for providers, clarifiers for pharma. And this is where we are finding ourselves now. We are working now with breast cancer, prostate cancer, and multiple myeloma, and we're moving towards lung cancer and the rest of the pathologies. 38.4% of the American population is going to be diagnosed with cancer in their lifetimes, and this is going to be the same for the rest of the world population. Probably world population will go up to 40%. So this is our target market at the moment. We see that there's a lot of people that's going to be needing of our help. Currently, we're having businesses with the Fundación Santa Fe, with Tower Urology in Los Angeles, with Roche, Janssen, Pfizer, and Boehringer, which are our main clients. And we had in the past with the government of Magdalena, which is like a state in Colombia, and with a nonprofit called Colombian Hematology and Oncology Association, we were awarded the first prize, Hernando Sarasti, last year for hematology and oncology with this type of development. Competitors, well, we do have this, which is a simple one, but Maia does not compete exactly with all of them. We compete in this scenario as an ecosystem, but none of them have the social network. None of them had included a niche solution for cancer, and none of them had back all their interactions with analytics and AI. So in that sense, we are top of the notch. We're asking now for $1 million, just the seed round, and we have a committed investment of $100,000. So what we wanted to do with this is, as you see, the go-to-market in the US, the engineering development for new releases, a social network requires a lot of engineering, and the landing and corporate, as you see. So those are our numbers. We so far had built the pharma for 184K. If we take the 0.2% of the market, we expect to have 2 million in revenue. And this is supposed to go organically in 5 years to the 8.4% of the market to over $40 million. And that's our expectations at the moment. So the way we're working is that we hopefully are going to be going for the third quarter with the social network, and for the fourth quarter with a full cancer suite. That's how we're going to be developing our roadmap in this year. We have a third group of technology and medical team. Each time that passes, we have more and more medical people helping us. And now we have another doctor coming from the US, from the UK as well, to help us. They are validators of the technology. And this is very important, because what we do is translating technology, helping patients, and those validators, because you don't treat cancer as you like, you treat cancer as the community has decided to be, and how the science community has said to be done. So help us save life and help us move forward Maia in the American market. Any questions?